sometimes the patient will not be able to feel it. That means immediately we have to say, oh, head injury or stroke. And it is right. You may be having any condition. The point is, to some point, the smell is affected. It is not sure that it is affected because of the olfactory nerve. Olfactory nerve lesion has happened already, so that only the patient is not able to feel the smell. Like that, you should not confirm it. Okay, there is something happening. He's not able to smell it, or he is not able to feel the smell. Okay, what are maybe the reason? One by one, we can see. For example, he may be having mild cold, common cold, runny nose or stuffy nose, so that he is not able to smell it properly, right? Or else he may be having acute or chronic sinusitis, so that he is not able to smell it properly. The smell is not able to reach the nostrils, reach the part beyond the blockage, right? Or else, definitely coming to a particular point of neurological disorders, like, for example, unable to find the smell without any sinusitis or without any blockage, without any actual damage or something, is a classical sign of schizophrenia. Schizophrenia, it is one of the confirmation point. The patient will not feel about the smell, especially bad smell. They won't feel. If you show, they will be living in a particular room where you will be feeling lots and lots of bad smells will be there, but they won't feel. They will be living nicely. That's the typical sign of schizophrenia. Okay, and they'll be wearing very dirty dress, which is already smell. They'll be wearing that same dress for 10 days or 15 days without washing, but they'll be wearing nicely. They won't take bath and they'll feel it's good only, it's fine only. Why you're saying like that? They'll ask like that. Okay, that's a classical sign of schizophrenia. Okay, anyway, we are not going to deep into that. We'll see afterwards. Okay, that may be looking like a biography. We'll see later. Okay, anyway, this is about olfactory. Any doubts in this? Cut.
Stop.
As I already told you, we will not be introducing any hyper irritant smell. For example, I told you, I'm going to introduce him from fine coffee bean or directly coffee smell. Okay, he is sitting like this. I am introducing him coffee smell, and I am already I have wear some irritant smell scent or something like jasmine or any axe wood or something, some dark tempter, some scent I have already used, and I am introducing him like this. What he will do? He will sniff the coffee. At the same second, he will try to sniff our shirt. That smell is axe, sir. But we are asking the question about coffee. But he will say the answer, that smell is axe scent, sir. That's not the right answer. One. And already it shows, already he is diverted toward the shirt's aroma. I mean, that scent smell. So that is not correct diagnosis. Okay. Or else, female, they'll be having 5 pounds of jasmine and then introducing the coffee towards the patient. They'll be wearing it like this, turning like this. Sir, how do you feel, sir? Like this. How it will be? Fine jasmine, madam. They'll say, right? But they won't feel about coffee. Sir, what is this? I'm not able to feel this, madam, but I'm able to feel that nicely, madam. That is very nice, madam. He will go somewhere else to romantic mood or something. But anyway, he will not feel about the coffee, right? But he doesn't know the romance starts with coffee only. But anyway, he's so deep into that, and he will say, Jasmine, madam, so nice, madam, like that. That is not a good diagnosis, actually. Okay, that is wrong. This is one thing, and of course, we are able to make a joke at it. We socially, jovially, it is fine. But the point is, the patient, especially with head injury or acute head injury, a recent surgery, maybe 1 day or 2 days, recent surgery, they will be having fluctuated seas of flow, fluctuated seas of pressure. And when you are introducing hyper irritant smell, definitely they'll start to collapse maybe immediately. We will be introducing this kind of smell, even this kind of small smell. You may be thinking how it can cause this, but that may stimulate the irritation, create some irritation because of creating some mood swings. It may create some irritation that will make the patients restless. So CSF will be altered and BP will be altered. They will start to collapse immediately. We may be thinking, what is the reason? What is the reason? But the simple reason may be like this. Or else, for example, you may be asking some question. A fine student will be asking a good question because I was having this mind. This is a clean room of a patient in a special room of a hospital. We will be introducing coffee smell or bean smell, but already the room is filled with phenyl smell, right? Sanitary smell, phenyl smell. That is hyperirritant. Do you see that? Have you ever visited a hospital and have you felt it? I was having this doubt for a long time, but the point is that smell will not be there for a prolonged period of time. After some half an hour or 1 hour, the smell will be faded away, right? So we have to do this test after that time only. I told you in a clear, perfect condition. We should avoid such a condition, such a timing. We should go after 10 minutes or 1 hour, maybe after lunch. The smell may be faded away. After that, we can go and assess. At that time, the smell will not be there, right? So we have to choose correct time, correct question. If suppose the patient is already sleeping, sir, get up, sir. Now I will have the time. No, okay, what is the smell? No, that's not right. He should be completely aware what we are going to do, and he has to be able to respond to us. We should have proper cooperation, proper environment, proper smell, without any interaction of other smells. It should be devoid of other hyper irritant smells, right? No disturbance, no distractions at all. At the time only we have to go. One. Second thing, when we are introducing, we should give proper timing to the patient. At least 20 seconds. The theory says 15 to 20 seconds we should give time. He has to correlate with that and he has to say the answer. And we have to make test once or twice. We should not continuously give 5 times or 6 times. That will get accommodated. No, find one time or second time. That's all. Gently, we have to go for 1 time or 2 times. In between each test, 1 time or 2 times, in between each test, at least we should have 15 seconds gap. And for one test, I'm introducing one smell. For one smell, at least I have to give 20 seconds time to respond. So this is normal. Okay, so we are going to test olfactory nerve. Any doubts? Yeah.